How do we reimagine health systems for better health and social justice? The three key barriers to entry for adequate healthcare are accessibility, affordability, and acceptability. An example of addressing this is the Bertha Centre Health Systems Entrepreneurship initiative, which worked to facilitate radical collaboration between 5 Africa-based organizations working at the front lines of healthcare. This 2.5-year project, funded by Johnson & Johnson, facilitated a neutral space for this cohort to share best practices, learn from each other in a meaningful way, advise, and collaborate. We believe that radical collaboration is a crucial lever for achieving health equity.
There is a perception that within the nonprofit space, and particularly in the global health space, that there's a scarcity of resources.
We've done a lot in terms of breaking down that competitive drive between us, sort of building those relationships.
To come together and think about this common topic such as system change has been a really interesting way for us to all reflect on where we fit within systems change, but also learning more about the uniqueness of each of our organizations and our work.
This program has been instrumental in building and strengthening a lot of those relationships. By virtue of the peer visits, by virtue of the cohort calls, by virtue of the convenings that we have together one-to-one and building those relationships.
The site visits have given us a better understanding of the nuance of the projects on the ground.
Our senior manager of technology is now speaking to the Muso technology lead in Mali because they're trying to talk about things related to the digital health solution.
To discuss programming or to jointly secure funding opportunities.
It's been a deeply enriching experience learning from the different organizations that are really driven by the same mission.
Of particular interest was how to successfully integrate innovative health interventions with government and existing health systems.
How do you express the challenges at the front lines of health and get the solutions that happen there up to national decision makers so that policies can reflect the experiences of frontline healthcare workers?
Taking the best practices that we've developed over our 10 years of operation and trying to see how we can support governments and other organizations to adopt those best practices to strengthen their own community health systems.
We innovate, we implement with government, and then we hand over to government.
What makes the Bertha Centre unique is our extraordinary convening power. We're able to bring together a variety of different stakeholders, such as funders, government, social innovation organizations, academics, and practitioners in one room where we can discuss and collaborate around those issues that have the greatest systemic impact in our society today.